keep them off. So I did a live the other day, and I did it at the apartment where I've just moved in, and I was talking very quietly, and I just didn't feel right in in the mindset I was in, simply because obviously it's new things. I didn't want my neighbours to know that I was kind of poorly, which makes no sense because in a month's time, I'm going to be having my medication where nurses come in and go, and they're going to realise that this person's not well. But I just thought I'd do a proper live in this setting until I'm comfortable in my own apartment, if that makes sense. So yeah, I thought I'd come on, and this time I normally get a few locals as well. So I'll probably just do a follow on from the video that I went live with. I kept it private, so I'll just talk about what I spoke in that video on this one. So let the people come along. It's the 2nd of September, guys, and I think we're flying through September. But as soon as I think that, guess what happens? I just got a message. Yeah, guess what happens? It's gone slow today. It's been one of the slowest days. So yeah, once you start realising things are going fast, it takes a turn for the worse and it goes slow. And why I'm wanting things to speed up in this scenario is I've got a lot of things going. I'm getting the floor fitted in the apartment. I'm at a wedding. I'm hoping I can, attend the wedding. I know it falls about the time my IVs are due I think mid October they're due. So I'm hoping I can keep myself okay with what I've got to hand, which is nebulized treatment. I've just done a 2-week course of doxycycline for an infection. I didn't send the sample out. I just knew things were slowing down. Appetite slowed right down to the point where I was having 1 to 2 meals. Felt a bit tired. The sputum changed colour from the chest to the nose. It was proper green. So in the end, I just jumped on him, and I thought, worst case scenario, if it doesn't work, I'll send a sample out. Let me get them glasses off. So I didn't need to check my hair here, guys. It's going long. All right, Judad. Yeah, so worst case scenario, I had to send the sample out. I did it in this occasion because the doxycycline did its job. But what I do need to tell my chest specialist, and I brought it up in the last appointment, that every time I get this infection, which has been persistent for the last 2 years, is I've had this radiating chest pain in the back. Now, normally, predominantly, my chest pain has been near the collarbone, near here, or just below, just above the ribs, and sometimes centrally. So that's where I normally get chest pains. But for 2 years now, I've had like a persistent pain during the infection, and then even after the infection, and it's right in the back. If you could place the palm in someone's back, it'd be central. So yeah, I've been having to take paracetamol. It's not been that bad where I've had to take codeine, which is good, because a few years back I was on codeine for pains and it was causing stomach issues with constipation and things like that. So I'm lucky in the sense that the paracetamol's doing the job for now. What I'm not happy with is that I keep getting this constant back chest pain, which is nothing to do with the heart. It's definitely to do with the infections, which is making me think, is the infection isolated in the back of the lung? I don't know. But yeah, and if it's, say for instance, I'm lifting my arm up or doing anything like that, I seem to get the chest pain at the back. So yeah. So I just thought I'd come on, see how people are doing. But I don't think my locals are on. They might be busy. They might be sleeping. But I hope you're all well. Yeah, so I've just finished 2-week course. I didn't need steroids, so I was lucky in that sense. I just took the doxycycline. Still feeling a bit fatigued. Whether that's just because of, my body's trying to catch up now from the lack of sleep, the lack of food, whatever. And I'm just having a little bit of a backlash from the infection. That's what I hope it is. I hope it's nothing serious where the doxycycline's just touched your surface and I need even more, or I need to jump straight on my gentamicin, which I should be doing anyway. But because the new apartment and things like this, sometimes we slip on treatment. We're only human after all, yeah. So anyway, I'll keep you posted. I've not been going live. I've been too poorly. I've been too, tied in different areas. So that's the reason why. Thanks for everyone who comments and says, "Where have you been? Hope you're okay." Most of the times, if I go quiet, it's one or two things. I've got an infection, or I've got my hands tied. So that's all it is. Don't worry about me too much. If it's life or death, I usually be the first. Usually be the first to know. Don't think that I'm. If I go quiet, I'm really bad, because I will make it. Known to you guys, because I know you care. So don't get worried. All right. You all take care. Please subscribe, and I'll be back. I'll probably be back when it's close to my IV therapy. Yeah, all right, Gino De Campo. Yeah, I wouldn't say I'm great. I wouldn't say I'm great. I'm saying I've just got over a chest infection again, which I believe to be the one that I'm colonised with, which seems to be Staphylococcus. It used to be Haemophilus influenza that I was colonised with. Now, I can't get the word out of me. I can't get the words out. Haemophilus influenza seems to have bypassed now. I don't know why, but it's not one of my frequent bugs anymore. So it seems to be like I'm colonised with the Staphylococcus, which is doing my head in. It's been like that for 2 years, guys. It's normally shown up in every sputum sample that's shown a chest infection. Yeah, so the Pseudomonas hasn't really shown its head for a while, but as we know, it's not always necessarily means that the Pseudomonas is gone. It just means that the Pseudomonas is good at hiding, and it does very well in hiding on, samples. So we all know the difference when you get to a certain age, or you've lived with a condition. We know when we've got Pseudomonas or Pseudomonas symptoms, because they're different. They're different compared to your normal infections, which is your Haemophilus influenza. I still think Streptococcus is a very bad infection. I think just because it's a common one, that they say it's not very serious, but it can be life threatening. Any infection can be life threatening, guys. So make sure that if you struggling, you developed a wheeze, your daily activities have slowed down, or your appetite's decreased, but you feel okay. These are all signs that the body's giving you signs that you're probably in the incubation period, so you're not in a full-blown chest infection. But this is what I do very well at. My specialist said I'm probably one of his best patients, in the sense that I know the say the mechanisms of the infection and how they start. And say, for instance, I feel unwell, I'll send a sample out, and it won't show nothing, but I guarantee you a week later or 2 weeks we'll repeat that sputum test, and it will detect the bug. So what I'm saying to you is, guys, be vigilant. Just make sure that key factors of the decrease in your health, because that is going to be the main factor how you are going to prevent your lungs decreasing in health, decreasing in health, by monitoring that and acting on it as it happens. Obviously, if you don't have a great specialist and you go to a doctor, a GP, they're not gonna throw antibiotics at you, because one, they don't think they need to treat anything. Two, they want to hold them back until you really need them. But people like us, we're dependent on them. You start taking antibiotics away from people with chest conditions like ourselves, you're going to really impact their health, and you could probably decrease the life expectancy. It's as simple as that. So, with that being said, guys, take care of yourself, take care of your loved ones. If they're coughing more, if they're wheezing more, if you just spot something and they say, "Oh, I'm okay, I'm okay, I'm okay," it's probably harder getting someone to do something than it is doing something for yourself. We've all had that loved one, that family member who is very stubborn, where they give you a sort of insight that, Or if any of my family members was poorly, I would take them to the hospital. I would take them to the doctors. But when you flip the script and it's them who are poorly, and you say, come on, start doing your rescue pack, start doing your nebulizer, send a sample out, they just don't listen. So with that being said, I'm signing off, guys. Thanks for everyone who stayed, and please subscribe.